Good morning, everyone, and welcome. Today, we have our friends from Total Benefit Solutions here to discuss hospitality health insurance and some of the benefits you can get through that. Before we get started, though, I am going to take care of a little bit of housekeeping. If you have a question for any of our panelists, please be sure to type them in the Q&A. It's down at the bottom of your screen. And after the presentation, we will get to that and answer your questions live. And this will be recorded just for your information, and we will have it up on our website later on today. And with that, I'm going to hand this off to Kylie Fries. She is our Suites and Incubation Program Manager here at the Washington Hospitality Association. Good morning, Kylie.
Thanks, Lisa. Hey, everyone. I am here as our program manager to help connect you with our team. Through HHI, we provide comprehensive medical, dental, vision, and EAP. Our program is broker agnostic, meaning you're welcome to work with any broker that you'd like. With that being said, I am pleased to introduce our partners at TBS. To you, John.
Great. Thank you very much, Kylie. John Henry, President of Total Benefit Solutions. We are the consultant that Washington Hospitality Association selected to work with you and to build a compelling and impactful employee benefits program. So today we're going to go into a little bit about the hospitality and health insurance offering, what we call the benefits buffet. We're going to talk a little bit about the health plan options, the Kaiser wellness benefits that are out there in addition to just traditional employee health insurance, the Aetna wellness benefits, and we're going to go over some of the additional plans and offerings that are available to you, members of WHA. So we put this plan together over the past 3 years to help really meet the unique needs of the hospitality industry. The groups that are eligible need to be headquartered in Washington. We have a lower participation and employer contribution level than you would need to do if you went direct to the carriers. We can go down as low as 2 enrolled employees on the health insurance, as well as we can do management carve-outs. For groups that have 10 employees or more, you can choose up to 3 medical plans from either Kaiser or Aetna. And then who is eligible? The eligible classes are any industry company that you would think falls under the umbrella of hospitality. And here are a few examples. Restaurants, bars, lounges, those are the ones you traditionally think of, but also things like recreation, gyms, events and conferences, travel and tourism, restaurant supply. So it's a really broad group of eligibility that would allow an employer to participate in the Hospitality Health Insurance Trust program. We understand that health insurance and the related ancillary coverages can be really expensive, but we wanted to talk a little bit about what do you get aside from, in addition to, employee appreciation when you have a health plan that's provided to your employees. We believe and we see every day a boost in productivity from employees who have the comfort and the peace of mind of a good health insurance plan. It helps with employee retention. It helps with employee attraction when you're hiring for good people. It improves employee morale when somebody knows that if something happens, they can go to a healthcare provider and or their loved ones who are covered and insured. And it produces better outcomes, and then it also just improves the overall workplace productivity because people can be healthier. With that, I'm going to pass to Tatiana, and she's going to talk to you a little bit about the HHI health plans. Over to you, Tatiana.
Thank you. My name is Tatiana. I'm the account manager for HI. Just wanted to say thank you to everyone for taking a little bit of time to learn just a tad more about what your employees and their families could use. I know from working with your brokers directly that they too are very thoughtful on uncovering what works best for you all. As you may know, HI is able to offer a wide range of benefits, but please note that all benefits are independent of one another. You do not have to purchase one benefit in order to have access to the other. As a quick overview of what carriers we use, for medical we have Kaiser and Aetna. For dental, it's Emeritus and Willamette. We have Emeritus for Vision. And then for EAP or Employee Assistance, we have ComPsych, Teladoc for telehealth, and Transamerica for life insurance. Here's a quick rundown of the Kaiser medical offerings. There's 7 PPO plans, 8 core HMO plans. Both of them have a high deductible health plan or a better known as HSA option. To round it out, we have 4 virtual plans, which in today's climate is quite valuable. With our other carrier, Aetna, we have 13 PPO plans, 4 Aetna Whole Health, which are HMOs, and a couple of the PPO plans have the flexible 5 option, which is when the first 5 visits of the year are covered at 100%. While there are plenty more details on the available benefits through HIE, we're here to discuss what is not so plainly written in the summary of benefits, the carrier wellness options. Kaiser has partnered up with Calm and Headspace to take care of us. As long as you start at the login of your website, the kp.org, your member website login, these are offered at no extra cost to you. Calm is the meditation app. Meditation is nothing new. It dates back to probably 200,000 years ago. What is somewhat new is a guided meditation. And if you don't know where to start with meditating and it just seems a little bit overwhelming, this is the perfect place to start. I'll also say the second thing on that list in Calm app is the sleep stories. We were just talking about this before everybody joined. I thought it was going to be super silly. I'm a grown woman. Why would I need that? But I'm telling you, by the third night, I craved my bedtime story, and I still do. It doesn't put you to sleep, but it definitely slows things down and lets you get relaxed. It might put you to sleep. Some of us it does. But Headspace is the more active role in seeking calmness. It has one-on-one coaching and self-care activities, and it's even available through texting. Something to note though, Calm can be used for members aged 13 and over, and Headspace is for 18 plus. OnePass is Kaiser's subscription-based fitness membership program. So starting at $10 a month, you can cancel at any time. There's no contracts whatsoever. This gives you access to gym locations, on-demand classes if you like to work out on your own, or live stream classes if you crave that community aspect that some of us do. I'd also like to note that with OnePass, as long as you have a membership, any level of membership, you can get 20% off of a chiropractor, an acupuncturist, and a massage therapist, as long as you're using one of the Optum providers. So if your plan doesn't already have those benefits and you're looking to have access to gyms and online fitness classes, this is a win-win. Kaiser's 24/7 consulting nurse service is great for quick advice like drug interactions or what is a normal symptom. They have a toll-free number that you can call, and you can call it as many times as you like at no extra cost. Just note, they assess the urgency of your issue whenever you call and place you in the queue accordingly. If you'd rather use email, there's an option for that as well. It's just for non-urgent questions, and they have a 24-hour response deadline for that. With this service, there's more than 60 nurses that work the line, but there's always a doctor 24/7 for more difficult situations or medicine prescribing. I also like how all the info is stored within one electronic medical record with this. So if you needed help at 1 a.m. on a Saturday, when your doctor comes in, your regular physician comes in on a Monday morning, everything is right there for them to see. Note that when you do call the toll-free number, it is smart to have a list of medications that you're already on and the list of questions, just so that you don't panic and forget what you actually need to ask. HI's other carrier has a few programs that we'd like to highlight. Their over-the-counter health solutions program is an automatic $25 per quarter per member. So this includes your dependents. This is specific to CVS, and there's a list of applicable products online. You can also see which products apply when you're in the store, which brings me to my next point. There are several ways to redeem these. So you can shop in store. Just know that you will need your first and last name and your birth date. It's a lot like picking up a prescription. You do have to talk to a human. You can't use a self-checkout because they look you up in the computer system. If you would rather shop online, you just have to create an account. You will need to create an account for every member on your plan so that they can each have their own $25 allowance, and you'll use your member ID numbers in order to do that. Aetna has the digital health platform called My Active Health, and this is where members can earn up to $100 in electronic gift cards a year simply by doing things that you're already doing or that you should be doing, like preventative exams. You can connect your activity tracker for points. You can take an assessment. All of this applies, and it's $100 a year. The Strong and Smart program is something that is specific to the hospitality industry, which is super applicable here. They're available through the member website login, like the Kaiser programs were. That way that you can get these at no additional cost. For the body, Aetna has partnered up with Hinge Health. You take a survey and you get custom content sent to you that you can do on your own anytime. For the mind, they have resources that can help you relax, help you sleep, and even help you deal with challenging customers, which I know none of us have ever had in the hospitality world. Aetna too has a 24/7 nurse line. It's a lot like the Kaiser. It's toll-free and can be used as many times as necessary. We've seen this be used for things like additional questions on tests and procedures. So if you forgot to ask if you need to fast for a certain lab work, or if you need to make sure there's no metal in your waistband for a procedure. So you can also send the email with this one as well. The next two carriers are meant to help with mental health, and we'll show you why. ComPsych is the EAP carrier. Paying attention to our mental health is more important than ever, and I don't think anybody can argue that. It just so happens that that's what our members use ComPsych the most for. Reporting shows that counseling and legal issues are the top reasons that we use it. For $1.82 a month, employees and their dependents each get 6 sessions per issue every year. No extra cost. So the issues could be raising a teenager. Another one could be undoing the knot in your chest from raising the teenager. Last could be financial planning. A lot can be resolved in 6 sessions, so please encourage your employees to utilize this awesome resource. Teladoc is the telehealth carrier we use. It's been used by our members in a surprising range of ways, from dermatology to ear, nose, and throat to urology. It's for good reason too. When someone is registered ahead of time, which we highly recommend, the average wait time to have a doctor call them back is less than 5 minutes. That is less time than it takes to wait for a new pen that works at the urgent care check-in. At $265 per month, I can't think of anyone that wouldn't use this benefit. I know we've gone over a lot here, and I don't expect you to have memorized all of it. So if something has caught your attention, or if you want a little bit more information, or maybe a flyer to put in the break rooms or to give out to your employees, just have your broker reach out to us and we'll be happy to send it. Thank you.
Well, thank you. I do have a question for you. And if anybody has questions, please put it down in the Q&A on the bottom of your screen and we can answer that for you live. At the beginning of the presentation, you guys mentioned that you only need 2 employees to enroll. Are those full-time equivalent or those 2 employees?
That is 2 eligible employees, so full-time equivalent.
All right. And is there anything you guys want to mention if we wait a little bit for some questions to come in? Anything you didn't talk about?
I don't think so. John, Haley, did I miss anything?
I think it's a pretty good overview. Like you mentioned, I think the best thing to do if you currently don't offer benefits and are thinking about it, then starting at a place like the EAP or the Teladoc is a great place to start. And those two products do not need, that could be for part-time people as well. The full-time eligibles was specifically related to the medical insurance through Regents, or excuse me, through Kaiser or Aetna, as well as the dental from Emeritus or Willamette. But the Teladoc and the EAP are available for all your employees, part-time or full-time, and a great way to start. And as Tatiana said, we work with all brokers. So if you have a broker, talk to them about getting a quote. And if you do have a benefits plan and you just want to see how we stack up, I think you'll find that we're very competitive, and in a number of ways, from the reduced amount of contribution that's required from the employer to the reduced amount of participation that is required from employees, and the fact that we can do carve outs for management. We know that's extremely important with restaurants and the hospitality industry, because a lot of your employees are going to be short-term or part-time in nature. So it's a really flexible set of plans and options. We'd love to talk with your broker about giving a competitive quote.
We also have awesome customer service. So
Definitely, I agree with that.
All right. Well, thank you all so much. For everybody watching, this will be up on our website later on today, along with the slideshow. So if you need their contact information, it's provided there on the last slide. And give them a call if you have any questions. All right.
Thank you so much for everybody's time. Really appreciate it.
Thank you.
you.
Have a great
Bye.
day.
Have a great day. Bye-bye.